Hi, and thanks for watching this webinar. This will give you an overview of the AMA Opioid Change Package Demonstration Project and let you know step by step what participation looks like and how to join. So what is the demonstration project? Well, first and foremost, it is an opportunity for teams that are confident in their foundational elements like panel identification processes. The demonstration project is an opportunity to access some EMR support to continue to optimize your EMR in measurement processes. In this case, specifically around offers of care. In another webinar, Dr. Brad Baylor talks about the value of measuring offers of care, so do check that out. To be clear though, this is not a new ask or additional work. The demonstration project uses the exact same measurement toolkit that is used for the quality improvement measurement for the rest of the opioid change package. It's the same tools and the same measures. The only difference is that in exchange for sharing some of your measures with us to help us fill an information gap, we're offering up to 20 hours of EMR support for your team. So what is that information gap? Well, it's around patient-centered care and making offers of appropriate care that align with the patient's state of readiness. This project will help us to understand how the EMR can be leveraged to document and measure offers of care. So we'll go through a quick overview before we get into the details. So participating in the demonstration project is at the physician level. You could have more than one physician at a clinic participate. There are only 2 data submission time points, a baseline and 6-month follow-up, during which time you will have access to that consultant who will assist you in optimizing your EMR. Submitted data will definitely be anonymous and only used in aggregate. Now, in the opioid change package, the demonstration project focuses on 3 metrics. You can see them: the number of patients on your panel with opioid use disorder, the number of patients on your panel with opioid use disorder who have been offered opioid agonist therapy from their patient's medical home. So that could be from the physician participating or a referral made to a physician who can make that offer, and the number of patients with opioid use disorder on your panel with opioid agonist therapy. Any other metrics that you happen to be tracking, which are included in the tracking Excel tool, would be optional to submit. So let's break it down into steps. This list may look a little bit long, but definitely you were probably doing this work anyways as part of your process improvement efforts. So step 1 is simply identification of a potential participant. So many improvement facilitators may be aware of teams they've worked with in the past who may be interested in an opportunity like this, or a team member may feel like their team is ready for this opportunity. So the key is that absolutely anyone can raise their hand. The next step is actually a tool that will help you decide if this is right for you, but there is no one way to enter the demonstration project. Anybody can raise their hand. So the readiness assessment, step 2, is a list of 9 statements that you can assess yourself on. So the improvement facilitator can fill this out on behalf of a team, or the team can do it together. To be clear, there is no set value or cutoff for acceptability. There's no number you're trying to achieve. This is a self-reflection tool to help you identify if you have the foundations in place that will enable success. So ideally, teams in the demonstration project will be established in their panel identification processes, have quality improvement experience, and have EMR processes in place as well. So if you feel satisfied with the readiness assessment, the next step is just to fill out some basic demographic information. It's really simple information about your practice. And together with the readiness assessment and the demographic information, you submit that to Bonnie LaCusta. That's actually me, so hello. You submit that to me, and that's it. That triggers enrollment. There is no being accepted into this project. If you've submitted these, that triggers to me that you'd like to participate. So my next step would be to connect you with that EMR consultant. They will be in touch with you to set up a meeting or maybe even a visit to the clinic and do a really informal needs assessment to figure out how they can best support you. To be clear, we do have some EMR guides that are available to everybody on the website. There is a generic EMR guide and then 5 specific EMR guides that offer screenshots and step-by-step guidance on how to measure and document offers of care, but that EMR consultant will be there to guide you as well. So once your EMR is set up, next you'll collect your baseline measures. Again, this is just those 3 required measures that we showed earlier. Anything else is optional. There's also a quality improvement tool we call the team assessment that we'll ask you to submit. This is a really valuable tool to use early on in your quality improvement team meetings. It can generate discussion about where this team has strengths or where there may be opportunities to improve, and can help focus your improvement efforts. These are also sent to Bonnie, that's me. So after baseline submission, you simply carry on with the process change that you had always planned to trial using the same opioid change package and the same tracking tool. So there is no required process here, nothing prescriptive about what change you try to implement. So for some, the demonstration project may not be anything different than what it is that you're already doing. So step 8 is after 6 months, we'll be in touch with you and say, time for your follow-up data submission. We'll ask for those 3 data elements again, and the team assessment to be completed one more time. So that actually completes participation in the demonstration project. The last step is optional participation in evaluation activities. So this project is helping us to answer about the ability to demonstrate tracking and measuring offers of care. We do have some additional questions that would give us extra context and help us to understand better, but your participation in any surveys, interviews, or focus groups would be totally optional. So I've got a quick sample timeline here, but I want to be clear, yes, we are enrolling participants into the demonstration project past the summer and into the fall, so we're not really paying attention to the March 2020 grant deadline. We are looking to get 35 to 50 physician participants representing all of the zones across the province, and we'll continue enrolling until we can hopefully achieve that. So hopefully I've already touched on a couple of the benefits to participating, but to summarize for you here, this project will ensure that you are tracking and measuring data that is meaningful to your quality improvement. We will help to build capacity at the clinic level within your team for EMR optimization. This definitely aligns with progressing towards patients' medical home transformation. You will have access to that direct support for additional EMR optimization, and importantly, you are contributing to advancing knowledge by demonstrating, and that's why it's called a demonstration project, the breadth and quality of work that goes into primary care and filling an information gap for us so that we can leverage that information to better support primary care in the future. So if you still have more questions, please feel free to reach out to me. I would love to chat with you, or do check out our other resources on the website. Thank you.